So we're at the NHS Improvement Conference, but it's a sharing event to look at different improvement things that are happening in all the different organisations.
What we've got here is kind of our vision for, say, the next couple of years, really. What we ideally want to do is use innovation to actually improve the capability of the health service to look after patients and also help with the delivery aspect.
I'm here today just telling people about some of the work we're doing at Southampton around improving the preoperative medicine pathway. This is a programme that looks at patients that have a high risk of complications coming into surgery, and this is a way of us assessing that risk early on and then giving those patients extra support.
One of the things that we brought today is our code accreditation scheme, which is a bespoke framework really for the wards to measure the quality of the fundamentals of care that they provide to patients. So by doing that, it's enabled the staff to have some real live data on how they're performing, what the patients think of the experience that they're having, and to really pinpoint some areas where they need to do some targeted quality improvement.
My stall's about the programme, the ESIP programme, and specifically today looking at sharing best practice and networking, but picking up those pockets of good practice across the country and sharing them on our network. So it's a really practical way of reaching out to staff, to the ground troops, to engage them in improvement.
From the lung cancer perspective, we've done a lot of work around collaboration, having trusts working across organisations and partnerships to improve outcomes. Going through a structured quality improvement process has brought down the time to radiotherapy for these patients from an average of 25 days to everybody now being treated in less than 14 days.
What we're doing is upskilling care home and nursing home staff around particular complex characteristics. So then the big money saving side of it is reduction in hospital admissions and unnecessary A&E attendances and out of hours calls from GPs.
We're here today to discuss patient level costing. So the thing is, we have within NHS Improvement, we've got a big push, which is the cost transformation program. So we're talking to trusts here today about the program, and we're talking about the improvements they can make with rolling out patient level costs at their trust.
We're viewing this as a good opportunity to raise awareness of our intensive support organisation and our offer for mental health, which is relatively new compared to the intensive support offer for physical health, and we're keen to engage with as many people as possible and let them know that we're here.
We worked on a series of programmes called the Productives that were well known through the NHS. Series is like the Productive Ward, Productive Operating Theatre. So we're here today to let people know, one, the materials and resources are still available, two, to explain how many organisations have used that material, adapted it and grown it, and thirdly, how we're now wanting to talk to people in the service about, if we were to refresh these programmes, bring them up to date, what should they focus on, what should they look like, how could they be delivered.
So we're here showcasing today some of our service improvement initiatives. A large number of these have been done by staff on the front line, so in partnership with our nurses, as well as some larger pieces which are trust-wide. Some of our initiatives have included some patient turning clocks, which help remind our frontline staff when they need to be moving patients to avoid pressure ulcers, and it's had a huge impact for our patients and positive impact on their outcomes.
We're here to represent a couple of the functions of the patient safety team really, which is primarily about learning from what goes wrong at the ground floor level. So learning from mistakes, learning from triumphs, learning from what people have to say about patient safety in their own organisations. And we're trying to say to staff, actually, by reporting and being open and honest about what goes wrong, you're actually helping, from a national perspective, the patient safety movement, because we can provide you then with advice and guidance based on what it is you tell us.
I feel quite energised being here today, lots of energy in the room, and I think I've just been sat making tons of notes to take back to my organisation to see if I can implement some of those changes, and it's the only way we're going to keep the fantastic NHS that we've got, is if we all share our experiences and our good practice.